Hello, podcast listeners. You are now listening to the Coffee, Health, and Science podcast. I'm your host, Jordan River, and I want to thank you for tuning in today. So excited for the guest that we have on the line today. He is a Harvard professor of medicine. He's a liver specialist and a coffee expert, an author, a speaker. Dean of Ongoing Education at Harvard Medical, Dr. Sanjiv Chopra is on the line. How you doing, Dr. Sanjiv?
I'm doing very well, Jordan. Just a slight correction. I served as the faculty dean for continuing education for 12 years.
Oh, okay.
My tenure is over.
Oh, well, fantastic. Only 12 years. Thanks for correcting us on that. You are the perfect person to have on for this episode because we are trying to educate doctors on this show. And that is what you've done for over a decade. So I want to talk today about coffee and health. I want to talk about how the consensus has changed over the decades and talk about what we know today when we're studying real high quality coffee. So let's first start with a coffee and health consensus worldwide or nationwide among doctors 20, 40, 60 years ago versus today. How does that look and why?
Yeah, 20 years ago, there was a scare that people who drank coffee may be at increased risk for pancreatic cancer, one of the deadliest cancers. And that article appeared in the New England Journal of Medicine. It was then debunked with multiple studies in that journal and many other scientific journals that are peer-reviewed. And about that time, I came across an article that said that people who drink coffee have lower levels of liver enzymes. So I was very intrigued about that because when you have high levels of liver enzymes, it's usually an indication that there's some ongoing liver problem or liver injury. Mm-hmm. And if it persists for more than 6 months, we call it chronic liver disease. So the first article that caught my attention was that coffee drinkers have low levels of liver enzymes. Then articles started coming out that people who drink coffee have less fibrosis, which is scarring in the liver. If there's a lot of scarring in the liver, as the doctors all know, and there's complete distortion of the liver architecture, we call it cirrhosis. And then people are at risk for developing liver cancer, myriad complications, the need for a liver transplant. So lower liver enzymes, less fibrosis. Then an article came out that if you drink 2 cups of regular coffee a day, there's a 50% reduction in hospitalization and mortality from chronic liver disease.
Wow.
And in aggregate, there's somewhere between 1 billion and 1.5 billion people in the world with chronic liver disease. Then multiple articles that coffee drinkers have a lower risk of developing primary liver cancer. So primary liver cancer, which means cancer arising in the liver, usually in the setting of cirrhosis, but not invariably. Chronic hepatitis B virus infection is an exception where 30% of the time when we see cancer arising in the liver, these are people with pretty healthy livers without cirrhosis. So multiple studies saying 40% reduction in primary liver cancer mortality. And that is the third leading cause of cancer mortality in the world. And in 11 countries, including Egypt and Mongolia, it is the number 1 cause of cancer mortality. Then other studies started to come out that people who drink coffee have a lower risk of other cancers. And those include metastatic prostate cancer, 50% reduction, 2 cups. And that's the bad kind of prostate cancer, the one that spreads often to the bones and can kill people. But also head and neck cancer, colon cancer, skin cancer, endometrial cancer. These are all pretty common cancers. Also, it turns out that people who drink coffee have a low risk of developing 2 diabetes. Now, one has to drink about 6 cups of coffee a day. And that, by the way, here, it can be decaf. And something like a 40 to 54% reduction, men and women. And if you already have type 2 diabetes and drink 2 cups, then about a 30% reduction in dying from heart disease, cardiovascular mortality. Other studies started to come out, low risk of Parkinsonism, cognitive decline, suicide, dental cavities, gout. And then an article appeared in the New England Journal of Medicine. And that day I got like 100 emails from colleagues and friends around the country, since I've been talking about coffee for 3 or 4 minutes in many of my liver talks.
Evangelizing. Yeah. Evangelizing coffee.
Yeah. I just love coffee, and it's such a simple thing to do. And it's the number one beverage in the world now, with 2.25 billion cups of coffee consumed each day.
Wow.
Companies like Coca-Cola have seen the light and recently bought Costa, big chain in Europe, for $5.2 billion.
Whoa.
So then this article said coffee drinkers, men and women, have lower total and cause specific mortality. And then more studies in the last 2 years, 10 European countries, almost 500,000 subjects. And what this shed some unique light, because in these 10 European countries, they drink the coffee differently, they make it differently.
Mm.
Didn't matter.
Mm.
Then a study from Hawaii in the same issue of the Annals of Internal Medicine. It was also a lovely editorial talking about these two studies. And this study from Hawaii said your ethnicity didn't matter. If you were Caucasian, Latino American, Asian American, African American, the benefit was seen in all groups.
Wow.
Now, mechanistically, there's something that all the doctors would be familiar with: CRP, C reactive protein. And if it's high, it's a marker of inflammation. It's linked to atherosclerosis and stroke, high levels. And coffee drinkers have low levels of CRP. They have lower levels of something called tumor necrosis factor alpha, TNF alpha. Even the name sounds very grotesque.
Yeah, that's pretty scary.
Yeah. And then there's something called adiponectin, which is usually made in adipocytes, fat cells, but also made in the placenta. And if you have low levels of plasma adiponectin, it's linked to aggressive liver disease, a particular one called non-alcoholic steatohepatitis, which is now the most common chronic liver disorder in our country, estimated to afflict 70, maybe even 100 million Americans. We're even seeing it in children.
Wow.
And it said that coffee drinkers have higher levels of plasma adiponectin. So low levels are linked with aggressive non-alcoholic steatohepatitis. Coffee makes the levels go up.
Fascinating stuff. Wow.
And then another mechanistic explanation why we might be living longer is about telomeres. And I think we're going to talk about that in the next podcast.
Yes, absolutely. But just touch on the overall longevity.
Yeah, just touch on it. You know, telomeres are linked to cellular aging. And we have shortened telomeres. We may live 4, 5, 10 years less than people with normal telomeres. And if we have longer telomeres, we probably will live longer.
Wow.
And coffee drinkers have longer telomeres. This is the Nurses' Health Study, close to 6,000 individuals. And what it showed, which I found really intriguing, because every time people say, so it's the caffeine, they immediately think of coffee and caffeine.
Mm-hmm.
And what this study showed was that increased caffeine intake was actually linked to shorter telomeres, but increased coffee intake was linked to longer telomeres. So the caffeine in the Coca-Cola, possibly in tea, in caffeine pills, etc., is not good for us. But the coffee and the caffeine in coffee may be good. It may not be the caffeine. Coffee has hundreds of constituents.
Mm-hmm.
There's one called caviol, another called caffeistol. And in the laboratory, you can take an animal and give it a potent liver toxin, destroy the liver. Repeat the experiment, this time pre-treat the animal with caviol or caffeistol, and it abrogates the liver injury.
Wow.
Coffee also has chlorogenic acid, which is one of the richest antioxidants known to man. It's insulin sensitizing, and that may be the mechanism
for diabetes
by which it protects against type 2 diabetes, because we refer to that disease as the disease with insulin resistance. So the insulin is still being produced by the pancreas, but the target organs are not reacting to it. So we call it insulin resistance, and coffee is insulin sensitizing.
Wow.
So, Voltaire, the French philosopher, lived to the ripe old age of 84 years, number of centuries ago, and life expectancy that time was in the 40s.
Wow.
And what I'm going to say is not proof that he lived longer because he drank a lot of coffee, but the amount he drank is astounding. He drank, something like 50 cups of coffee a day.
Right.
And sometimes, Jordan, when I mention this in my talk, somebody will raise their hand and they'll say, how big a cup? And my response is, does it really matter?
Does it matter?
If it's half an inch or a quarter inch, 50 adds up to a lot.
Totally.
So, very interesting stuff about coffee. My next book I'm going to write is going to be just on coffee because since I wrote The Big Five, which includes coffee, exercise, vitamin D3, nuts, and meditation, the first chapter devoted to coffee, almost 40 pages, with lots of references of research and articles published in prestigious journals. Many, many more studies have come out.
Well, let me ask you that. Let's touch on that then. So you say that there are some scary articles that come out. I know some in the 50s, and then you said it even just 20 years ago. Is the problem, especially among, let's move away from the doctors for just a second, is the problem among the public consensus that they read this article that says coffee's linked to pancreatic cancer, and then the newspapers and media outlets never bother publishing a redaction? They would never do that.
Or they do, but it's on the fourth page.
Right.
And it's one line or two lines, whereas the original article was on the front page.
Fine print.
And people remember that. They may never have read the retraction. I see even now articles by journalists on coffee, and they'll talk about, the health benefits. And then they'll say, yeah, but it can lead to heartburn and a little bit of a tremor. And if you drink it at night, insomnia. You may not get a good night's sleep. Maybe linked to heart problems. In fact, the studies are now showing that atrial fibrillation, very common cardiac arrhythmia, by some estimates, 1 in 4 people, 1 in 8 people will develop atrial fibrillation during life. There may be a low risk of developing atrial fibrillation in people who drink coffee. So, even these side effects of insomnia, tremor, heartburn are so minuscule compared to the benefits.
Yeah.
And then concluding sentence might be, well, these studies are very interesting. We'll see what future research shows, everything in moderation. In reality, the more coffee you drink, the better. Now, I do suggest to colleagues, friends, patients that, 2 to 4 cups is very, very healthy. You don't have to drink more than that. And I'm going to tell you something about alcoholic liver disease that will floor you. So for decades, we've known that people who drink a pint of whiskey a day, a liter of wine a day, or 2 6-packs of beer a day for 20 to 30 years, every day, drink that. Only 20-25% of those developed alcoholic cirrhosis.
Wow.
So what happened to the others? And we said, oh, maybe they have good genes, or it's something about the way they metabolize alcohol. There's an enzyme in the stomach called alcoholic dehydrogenase. It turns out the answer is coffee. If you drink that much and drink 1 cup of coffee a day, 20% reduction in alcoholic cirrhosis, 2 cups, 40%, 4 cups, 80%. It's not a license to drink heavily and drink coffee then to protect your liver.
Right.
It'll protect your liver, but you could still develop what we call course psychosis, cardiomyopathy, pancreatitis.
Still a neurotoxin.
Kill people on the road, ruin your marriage.
Ruin your marriage.
Yeah. I mean, still many other toxins from alcohol.
Yeah.
Now, I used to, until recently, attend for 4 weeks on a very, very busy liver service at the Beth Israel Deaconess Medical Center. And I taught all the interns, fellows, students. I said, ask every patient admitted to our service. There may be 20 people on our service, 5 admissions, 4 consults every day. And I would go for rounds and they would say, Dr. Chopra, nobody drinks coffee. And then one day I sit down and the intern has a grin and he says, we finally have a patient, Dr. Chopra, and he drinks 4 cups of coffee. And we asked him whether it's regular or decaf. And you taught us that to protect against cirrhosis, it has to be regular. And he drinks regular coffee. We even asked him about the size of the cup. And he pointed to an 8-ounce cup of water lying next to his table, on his table, next to his bed. I said, these are epidemiological studies. There are mechanistic explanations. He could be an exception, but I'll take my own history. So we go for rounds. They introduce me. I sit down. I take a detailed history. And then at the end, I said, tell me about tea and coffee. He goes, Doc, I don't like tea, but I love coffee. I said, what do you drink? He said, I drink 4 cups of regular coffee. And then anticipating my next question, he points to a paper cup. I asked one more question. I said, Mr. Smith, how long have you been drinking coffee? And he goes, since my liver transplant. And everybody fell over. I said, this is the art of history taking. He says, Doc, it's so weird. I never liked coffee. Since my transplant, I crave for it. Should I stop? I said, no, please keep drinking. He was in for a very bad infection. And because they're immunosuppressed, we take it very seriously. We admit them. And so I've yet to come across a patient who drank 5 cups of coffee a day and developed cirrhosis of the liver.
That is fascinating.
Very remarkable.
12 years you were doing those rounds.
Yeah, many years.
That's insane.
More than 12 years, yeah.
Wow, that's wild. Wild stuff. So just to wrap it up here, let me just ask you, if you have one piece of advice to give to the doctors who are listening now, who are either already on board and coffee evangelists, or maybe still a little skeptical, and they're wowed by your statistics and they're going to look into more, what do you have to say to them?
I'd say, read up on it. And there's so many different sources. You can Google and look at health benefits of coffee. If they want to buy the book, The Big Five, they'll see many, many studies, 40 pages on coffee. But I also encourage them to talk to their patients about the value of exercise. We know that's the single best drug. Vitamin D3 is the only vitamin I recommend we get one blood level checked once. And that even there's an epidemic of vitamin D deficiency, including young kids playing soccer in Florida, because the skin doctors have put a very good message out there, put sunblock. So a lot of vitamin D deficiency, but even if the vitamin D level is normal, it's the one vitamin I recommend is supplementation, like 2,000 international units a day. The fourth thing is nuts, all the nuts. You live longer.
Wow.
Including peanuts, which is not a nut, it's a legume. But there are now 2 studies just looking at peanuts. And here, I don't tell the patients, but we can share with our group. If you read that article in the New England Journal of Medicine again about nuts and longevity and read the discussion, it says even people who are overweight and don't exercise and eat a handful of nuts a day live longer.
Wow.
Now, people are concerned about calories. One pistachio has 4 calories. So if you have 25, you'll have consumed
100 calories.
Right. 100 calories. And if you consume it before a heavy meal, it'll probably satiate you and you'll probably eat less. So coffee, exercise, vitamin D3, nuts. And the 5th one is meditation. And it's not a religion. Many different kinds of meditation have great benefit. Also turns out longer telomeres in people who meditate. So the way I summarized it when I did about 35 interviews on radio and TV, I told the person who was moderating, whether it was 10 minutes or an hour-long interview, I said, give me 1 minute at the end to summarize in a way people will remember. So they all did that. And I said, here's the deal. On a good sunny day, go for a brisk walk to your favorite Java shop. Now you got the exercise, the vitamin D3 from the sun, and the coffee. Don't go nuts remembering this. And before you go, meditate. And there's an ancient saying, you should meditate once a day. And if you don't have time to do that, you should meditate twice a day.
I love it. It's fantastic. Yeah. Sanjiv, thank you so much for this wonderful episode. This has just been absolutely enlightening.
Oh, thank you so much. My pleasure.
Everybody out there, sanjivchopra.com. Find out all about the great books, The Big Five, The 2 Most Important Days, Leadership by Example. Tons of stuff going on up there. We love what Sanjiv is doing. This is Dr. Sanjiv Chopra and Jordan Rivers signing off saying, I'll see you next time on the Coffee, Health, and Science Podcast.